or good afternoon, I should say, and welcome to our noon chapter chat with Dr. Paul Byers, Dr. Charlotte Hobbs, and Dr. Jared Buffington from the Department of Health. We really wanted to just get everyone together for updates on COVID vaccine for kids aged 6 months and up. So everyone has the opportunity to have questions answered on ordering, on vaccine schedules, and on COVID updates for kids. So we have a lot of information to go through. Just a few quick housekeeping notes. This is going to be recorded so that anyone who is not able to be on right now can access the slides and the recording later, and we'll send that out through the Mississippi chapter of the AAP. If you also please would add your name and your location and your clinic in the chat box, we can all get to know one another virtually from our areas all across the state. And the last thing, if you have questions, as you think of them, please add them in the chat box as well, and we will get to them during the meeting. They might get answered, so we'll try and get through all the questions at the end of each speaker's portion, if that works. So I think I've gone over all of the housekeeping information, and I will go ahead and let Dr. Paul Byers get started. Dr. Byers, as everyone knows, is our state epidemiologist with the Mississippi Department of Health, and we appreciate his joining us today to talk about COVID vaccines in kids.
Hey, good afternoon, and thank you, Dr. Henderson. And I'm going to share a few slides. If you could give me a thumbs up that you can see my slides. Okay, so I'm going to give you a very brief update on the new recommendations from the FDA with their recent emergency use authorization for COVID-19 vaccines for children under the age of 5, which has been something obviously we've been waiting for quite some time, and we're very excited about it. And give you a little bit of the epi, but I know that Dr. Hobbs is going to cover some of the epidemiology of COVID that we're currently seeing as well. So I'm not going to spend a lot of time on that. I just want to all of us to think for just a moment, though, and reflect back on where we were this time last year. We were about to enter what we thought at the time was a very big increase in cases, and that was the wave that we saw as a result of Delta. And if you remember that Delta was exceedingly hard on hospitalizations and deaths, and we did see quite a number of deaths in children and in pregnant women as a result of Delta, followed closely on the heels by Omicron with the enormous number of cases that we saw that also led to hospitalizations and a pretty big amount of deaths. We were fortunate that we didn't see as many deaths in children nationwide with Omicron. But this is where we currently are with our epi curve. This is actually coming down off of the Omicron wave that we saw in January, really starting in December. You can see that we are trending up in our overall number of cases right now. We are seeing sort of a combination of several different COVID-19 variants in the state. They are all Omicron still, but are some subvariants of that original strain of Omicron. Primarily, we're seeing the BA 2.12.1, as well as now emerging the BA4 and BA5, which appear to be more infectious, but also have a better ability at evading the immunity from the COVID-19 vaccine. But the vaccine is still providing protection against deaths. And if you look at our overall number of deaths, even though we're currently seeing some pretty steady and consistent increases in cases, we're not seeing those concomitant increases in deaths, although we have had a bit of a bump. We'll have to watch those deaths carefully. But if you go back to the beginning of April, we have less than 100 deaths that have been recorded in the state, whereas there were many months during Omicron and Delta and before that where we were recording more than 1,000 deaths in just a month's time. This is a representation of a couple of CDC metrics, which is the COVID level of transmission and the COVID community level, which is on the right. These are two different metrics that are looked at by CDC. They're still both based on cases and the number of cases, and they're based on hospitalizations, but it's measured in a little bit different way. The graph or the map on the left is the level of transmission within the county, and that's actually based upon how rapidly case numbers are rising. On the right, the map is the COVID community level, and that's based primarily on the overall rate of cases as well as pressure on the hospital in that area. Both of these are on the rise. The map on the left, which is the level of transmission, is used to guide infection control practices in healthcare settings. So there are metrics that are developed to tell you when everybody should be wearing a mask, when you can do things like relax it a little bit more and allow vaccinated people to not wear a mask in a healthcare setting under very specific circumstances. But you can see that the entire map is essentially red. On the right is the map that covers the COVID community level, and that really dictates the recommendations for what measures should be taken in the community, whether a mask is necessary, whether you should limit larger gatherings. Just a few weeks ago, this map was all green, indicating low levels or low COVID levels in all counties in the state. Now we do have several, as you can see. That's really supposed to be red, but it looks sort of orange. Those are the counties with high levels of transmission. Again, just an illustration of where we're heading. Dr. Hobbs is going to show some of this information, but this is just a quick look at the proportion of cases by age group. You can see we've had some variability throughout the pandemic, but we have had some recent surges of cases in the 0 to 4 year age group. It looks like it's trending up. But if we look at emergency department visits for COVID, we see that those are up as well. Hospitalizations that we're having in the state are up as well. If you look at the hospitalizations by age group, mostly it's still in individuals over the age of 60 that account for the highest proportion of hospitalizations. We're still looking at somewhere around 65 to 70% of those hospitalizations in people over 60. But we have had recently a growing number among children. Remember that kids are still impacted. These are the cases of Missy that we've seen throughout the pandemic, the pediatric deaths that we've seen throughout the pandemic. And again, fortunately, we have not had a pediatric death recorded in the state since February of 2022. I'm afraid that that's likely to change soon with the increased numbers of cases that we're seeing. Remember that kids are significantly impacted by COVID-19 infection. This is a seroprevalence study that CDC reported out through an MMWR that estimated the seroprevalence of the population with SARS-CoV-2 antibodies during the Omicron surge. For the entire population, it was almost 60%. But when you look for children aged 0 to 17 years of age, the seroprevalence was about 75%, which means that during Omicron, there were a lot of kids who were infected. Now, quickly, just the vaccine update component. As y'all are aware now, and this has been big news for us, is that the FDA has granted emergency use authorization for both Moderna formulations and Pfizer formulations for younger children. Moderna has now been authorized for use in children 6 months of age through 17 years of age. Remember that Moderna had only been authorized for individuals 18 and older. So this is big. For Pfizer, now has received authorization for children 6 months of age to 4 years through 4 years of age. Previously, individuals 5 and older were able to get Pfizer. So the Pfizer vaccine for the children 6 months through 4 years of age is administered as 3 doses. The first 2 doses are given 21 days or 3 weeks apart. That third dose is given at least 8 weeks after the second dose. And that's only for children 6 months through 4 years of age who receive Pfizer. Now, Pfizer has also been authorized for that additional dose in children 5 years in age and older who are immunocompromised. And that's important. And it had already been authorized as a booster for anyone 5 years of age or older, or as a second booster for those people who were eligible. But the big change is that 6 months through 4 years of age. So for Moderna, it's two doses, 1 month apart for anybody 6 months through 17 years of age. Really now for anybody 6 months and older. It's also authorized as that third dose in the primary series for those children who've been fully vaccinated. Additionally, though, it was already authorized as a first and second booster for the older individuals. Moderna is not authorized right now as a booster for anyone under the age of 18. So that's important to remember. When you're given that booster shot to those children who are 5 and older, you need to use Pfizer. It's not Moderna. So we're going to be rolling these out at our county health departments starting Monday. Starting Friday, we're going to open up our scheduler so that people can go online and make an appointment at any county health department in the state for their children and for all the other vaccines that we've been providing. At the health departments, we only give Moderna and Pfizer. We don't give Johnson & Johnson, but we're going to be rolling those out. And these are the eligibilities. It's basically what I just covered. We're going to have it as the additional shot. But remember, those children 6 months through 4 years of age who've received the primary vaccine with Pfizer will have already gotten those 3 doses. So they're not going to receive an additional shot if they're immunocompromised. That's for people 5 and older. They can get that additional shot if they have a weakened immune system. And then the booster shot. So we're going to be doing all of those. We're going to roll it out. Again, first appointments to be made July 1st. We'll have the scheduler open, and then we'll be able to have folks getting the vaccine Tuesday, July 5th at county health departments. So that's kind of where we stand. I'm going to turn it over to Jared in our immunizations office, and he'll talk about how to order it and some of the dosing configurations for both Moderna and Pfizer.
All right, thanks, Dr. Byers. You said I'm Jared. I'm over the vaccine ordering and wastage in the Office of Immunizations. And I'm going to kind of talk today. I'm going to give an overview of the new pediatric vaccine products that are new, as well as some of the older products that are still out, just so we're all on the same page. Here's my contact information if you have any questions regarding anything in the future. All righty. Okay. So this is a list. I like this chart. It's kind of easy to follow. It's got all the current Moderna COVID-19 vaccine products that are available to order as of right now. This first one on the left, this is the kind of traditional Moderna, if you will. This one's been in circulation since the beginning. Originally, this was authorized for primary series for those 18 years and older. That has been amended. This is the product that will be used as a primary series dose for patients age 12 years and older. As Dr. Byers said, booster doses have not been approved for the 6-month through 17-year age group. So booster doses for Moderna are only authorized in patients 18 years of age and older. The concentration of this vaccine is 100 micrograms per 0.5 mLs. Primary series shots for that 12 and older age group is going to be 0.5 mLs given intramuscularly. Booster doses are half that, so 0.25 mLs. None of that has changed. Again, only that age group has changed. This middle product, this one, we had actually been waiting on CDC to drop these. That became available to order last Friday. Some providers have gotten them now. Some health departments are getting them in. This formulation was originally designed to be for booster doses only. It's half the concentration, so it's 50 mics per 0.5 mLs. So like I said, they were going to use this as just booster doses only, but the CDC decided to use these as well for the primary series for the 6 years through 11-year age group, because that concentration is the same. So for primary series shot for that 6-year through 11-year age group is going to be 0.5 mLs. It is, like I said, it is approved for booster shots. It is highly recommended not to use them as booster shots, just because I know that can get confusing. Now what we're doing health departments, we're saying this is only to be used for that 6 through 11-year age group. And for the infant population, the 6 months through 5 years, excuse me, is this formulation here. Some of our providers have gotten this as well. It's got a magenta border on its label with a dark blue top. I have no idea why Moderna decided to use dark blue tops for both formulations, but that is what it is. So this magenta or pink border label vaccine is going to be used for that 6-month through 5-year population. Each dose is 0.25 mLs, which is going to be 25 microns, and you'll get 10 doses per vial with that. With this, let me go back on this one. This one, you only get 5 doses per vial. Move on to some of the storage conditions. So for the newer products there, I know the infant, the 6-month through 5-year is not on here, but the storage conditions are the same. If these are stored in a freezer between -50 degrees and -15 degrees Celsius, they are viable until the expiration date. Now, Moderna loves to extend their expiration dates, so it is advised to make sure you check those. You can check those on Moderna's website. There's a nice, I call it the Moderna vial lot checker. You can type in your lot number and it'll tell you what the expiration date is. Highly advised to make sure that you keep those up to date in Mix, as Mix does not automatically update those expiration dates. Before it's used, it's got to be unthawed Here's kind of just some overview information on that. Kind of big picture with this, if the vials are thawed, they cannot go back into the freezer. Unpunctured vials, you can store them in a refrigerator for 30 days in case there's a temperature excursion or a power outage, anything like that. Once the vial is punctured, you have 12 hours to use it. And again, this covers all 3 products that are available. And here's something with the labeling as far as that Moderna 6 years through 11 years vaccine. Again, like I said, it was originally marketed to be for booster doses only. So these were manufactured months ago, and they've kind of just been sitting at CDC warehouses until they became available. So the labeling is going to show this. It's going to have booster doses only. And the vial is also going to say booster doses only. So just please be advised, these are approved under that emergency use authorization for that 6 to 11 year age group. And moving on to our Pfizer vaccines. So 4 products have been available. One is all but discontinued. We pretty much exhausted all of that original purple, what we call the purple top. That was the original formulation that was authorized for that 12 years and older population. That is pretty much out of stock. If you do have any of that, if it's been stored in a freezer or refrigerator, it is probably no longer viable. I know some of these had some expiration date extensions, so there may be some still sitting in your ultra cold freezers. So the 3 products that are available to order are these 3. Most are probably familiar with this gray cat formulation. That's for the adult, the 12 years and older. It does not need to be diluted like the original. It's ready to go. You're going to get about 6 doses per vial, and I'll go over how it's packaged in a minute when I go through mix. It's 30 micrograms per shot, 0.3 mLs per dose, and this is for boosters, primary series shots as well as boosters. There's no change in the dose. And the orange cat formulation, this is the original pediatric formulation for ages 5 through 11 years. That one's been in circulation for several months. It does require dilution with 1.3 mLs of normal saline, which is included in the ancillary kits. It's 10 micrograms per dose and 0.2 mLs per dose. Dr. Byers was saying this booster doses are authorized with the orange top for that age, for that 5 to 11 year group, with Pfizer only. And the dose is the same, whether it's primary series or booster. For the maroon top, this is our brand new formulation. I know several health departments and several providers have just now gotten this within the past week. This is approved it's approved under that EUA for the 6 months through 4 years of age. There is a little bit of mislabeling with the product, but I'll go over that shortly. It will come with diluent as well, and the amount of diluent that's needed is 2.2 mLs. We get around 10 doses per vial. The dose is 3 microns, and as with the pediatric vaccine, it's 0.2 mLs per dose. So it's going to be very important in practice. Just make sure you can put this on a refrigerator, print it out, put it somewhere. Just know which top associates with which age group, because we don't want to accidentally administer the wrong vaccine to the wrong patient population. little bit more information. This is the storage requirements for vaccines. As I said, we're pretty much done with this purple top. So all the gray top, orange top, maroon top, very, very similar storage requirements. If you have an ultra low temperature freezer and you're storing them there, the vaccines are viable for 12 months from the manufacture date. Now on with these tops, they don't put the expiration date on the vials or on the box anymore. The only thing they put is the manufacture date. So say, for example, you get this maroon top and the date says 1 of 22, so January 2022. So the expiration date would be December 31st of 2022. Again, 12 months from that date of manufacture. These vaccines cannot be stored for any period of time in a standard freezer. It's got to be either ultra low temp freezers or a refrigerator. If you don't have an ultra low temperature freezer, these vaccines are viable in a refrigerator for 10 weeks, beginning the day that you actually receive them, that you take them out of that ultra cold packaging. So just put a note or either a sticky note, write in Sharpie somewhere, put them in a bin, wherever you need to do it, just to make sure that you do not give this vaccine 10 weeks after you got it. As far as after puncture, it's good for 12 or after, well, for the gray top, 12 hours after first, you have 12 hours from after the first puncture. For the orange and maroon top, you have 12 hours after the dilution to use the doses, and after 12 hours, they must be discarded. Here, this is really important. This is kind of what I was talking about earlier. The maroon top vaccine is mislabeled. As you see here, it says for age 2 years to less than 5 years of age. It should read as this for age 6 months to up to 5 years or through 4 years of age. So just make note of that. Like I said, these vaccines were produced several months ago, so they were mislabeled. That is most information. That's pretty much what I've got on as far as the products that are available, some of the mislabelings of these new products, how to differentiate, which color goes with which vaccine, kind of things like that. Here's some additional information. These are kind of just resources you can go to. This is Pfizer's website for COVID vaccines. They've got a plethora of information. Same with Moderna. CDC keeps their website pretty updated. A lot of good information there. And of course, our state health department website. All right, so.
And Jared, we do have a question from Dr. Henderson, and I think it's an appropriate question.
Sure.
We had talked about the fact that the Pfizer vaccine is really the only one to utilize as a booster for those children who are in that younger age group over the age of 5. Moderna has not been authorized to be utilized as a booster for anyone under the age of 18 yet. And so there's a question about ordering. Is it required to order 300 doses of Pfizer for those age groups, or can you order a smaller allocation?
So I'm about to, I'm gonna pull up Mix in just a second, and I'm gonna go through ordering of everything, where to go to, what to select. I'm gonna run through that. But kind of short answer, the only Pfizer product that's required that you have to order 300 at a time is the adult Pfizer gray top. They have not lowered that minimum order quantity yet. I can put this up here. Just a second here. All right, you should be able to see my homepage of Mix now. So like I said, I'm going to go over exactly how it works. This is what you should see when you log into Mix. You'll have your name at the top. You'll have, what organization and what facility you're with. So to order, you'll come down here to this tab. It says order/transfers. You'll click on it. It'll open a new set of options. You'll click on create/view orders. And then you'll have this screen pop up, and you'll click right here. It says create order. Now, if you haven't reconciled your inventory in a while, this screen will pop up. It will require you to put which vaccines you actually physically have on hand. This is what Mix thinks you have on hand, and you would type in what you actually have on hand and hit submit monthly inventory at the bottom. For time purposes, I'm going to bypass this. This is the main order screen that pops up. It's got your information. It's got your your delivery dates and times. Now to order, you're going to click this where it says order set and click this little drop down. And ones I'm focused on right now are these three. These are your COVID-19 vaccines. Go through this first one real quick. This distributor/distributor is for, this is the 12 and up Moderna. Minimum order quantity on it is 100. And this one below is the 12 years and older Pfizer, the gray cap. As I said, the purple top is not available. Again, right now, 300 is the minimum order. If I try to type in 60 and submit, it's going to pop up at the top. Must be divisible by 300. So 300 is the minimum on that gray top Pfizer. Every other one is 100 doses. All the new pediatric vaccines are listed under this pediatric distributor. This first one at the top is this is the original Pfizer pediatric vaccine, approved for 5 years to 11 years. It's the orange top. Minimum order is 100. These are, it's kind of what it says, Pfizer 6 months through 4 years, maroon top, again, 100 doses. Moderna vaccine, 6 months through 5 years, 10 dose vial, 100 doses minimum. Now for the 6 year through 11 year Moderna, because you only get 5 doses per vial, this will come in 2 boxes. So each box is 50 doses. So if you are getting 2 boxes of this, that's what it's supposed to be. That's 100 doses. Just wanted to take note of that. These other ones, the other pediatric ones, 100 doses is just 1 box. I'll put in one and I'll delete it out, just so you guys can kind of see where it goes. So this took me back to my order screen, that home screen, that home create order transfer screen. This is the order I just put in. Once it's approved and once it ships, you'll have shipping data for it. And you can click here. And it looks a little different right now, but this is what we just ordered. Once it ships, you will have a tracking number, and you can copy and paste that tracking number into a search engine, and it'll tell you when it's coming to you. That's pretty much the gist of what I got. Are there any immediate questions I can answer? Anything kind of out in the open that haven't touched on?
Thank you, Jared. I have a question from Nikki Evans at Curry, and her comment is her clinic is not giving the vaccines. The hospital there in Tupelo had been giving them, but they were not sure if they were going to give them to the little kids. Are the retail pharmacies going to be giving them for little children? Have they ordered them, as far as you guys know?
So, pharmacies can get them they have a federal allotment. So a lot of, especially your chain, some retail pharmacies are getting them from those federal sources. As far as administering goes, the PrEP Act only covers pharmacists from any liability up to or 3 years and older. So to my knowledge, I don't believe pharmacists are going to be giving it if they're under 3.
Yeah, and I'm not sure, Dr. Henderson, about, and Dr. Vancic, about the, whether pharmacies have been given them administering doses to young children that don't typically do that. That's been one of the issues we've had before. But county health departments, we will have it available there for those children.
Great. Thank you. And I'm just going to make one comment real quick and we'll jump on to Dr. Hobbs and then continue to type messages in the chat box, please. But my clinic has been giving down to the age of 6 months since last Friday. And I will tell you, it's gone really well. Our parents are very appreciative of it. It's less painful, they have commented, than even the flu shot. So our patients are saying they're not feeling any pain or side effects. And so our families have been really appreciative of us giving them in our offices. I do have one question, and patients have asked us about co-administering with other vaccines. And I know the CDC has said that that's allowed and that's not a contraindication. So I just wanted to put that out there because I think that if you have someone who is in there just for a Hep A booster at 18-month or 2 years, consider giving them their COVID vaccine at the same time if they're interested. But again, it's not a contraindication as far as co-administration. And with that, continue to put your questions in the chat box, but I'm going to turn it on over to Dr. Charlotte Hobbs, Pediatric Infectious Disease at Children's of Mississippi. Dr. Hobbs.
There we go. Sorry, mute. All right. Thanks so much. So I will just run through a few quick things, which I hope will just recontextualize or build upon what we know our colleagues at the Department of Health have been making very clear and importantly clear. I think it's important right now because we're at a phase in the pandemic where everyone is beyond tired. And interestingly, even from, physicians I've spoken to, questions have been raised about, do we really have to do this in these younger children at this point in terms of vaccination? So what I'm hoping to do here is just to recontextualize everything, or at least build upon, I should say, what my colleagues at the Department of Health and Dr. Henderson have already said, but to kind of go over what's happening right now in pediatric COVID and the broader world for SARS-CoV-2 and COVID infection. This basically title slide just refers to a few of the most recent news flashes. As you guys know, Anthony Fauci just recently tested positive for COVID, and he's actually on round 2 of Paxlovid. But I'll be talking a little bit about Paxlovid and the other antiviral, which are available essentially for ages 12 and up, especially for higher risk children at this point. And we'll talk just a little bit about some of the recent data supporting the pediatric COVID vaccination recommendations. And I just want to highlight before I forget that when I was preparing this talk, I came upon this really fantastic video put out by Sesame Street where Elmo talks to his dad about getting COVID vaccine, and you could see the little band-aids on their arms. And it's actually a video that's really quite sweet and, can be used as perhaps help in talking to kids about the COVID vaccine. So that is actually available on YouTube. So briefly, I know Dr. Byers went over Mississippi State Department of Health specific data, but just to reiterate, actually, we are actually surprised to say, because I think, again, everyone's sort of a little bit fatigued with COVID, going through another surge, if you will, of SARS-CoV-2. Certainly, the hospitalization data and the mortality rates are lower overall. However, they are actually still occurring. And in the state of Mississippi, we actually are in a higher transmission area right now. And this again is based on reporting data. And we know a lot of people are using home tests. So this probably is an underestimate of what actually is going on. But if you actually look at the state of Mississippi, our transmission right now is pretty robust. In terms of overall pediatric cases, nationwide data, pediatric cases are actually just recently increased again, and actually are about 1% higher than they were at the beginning of the pandemic. As of June 23rd, the American Academy of Pediatrics reports that the pediatric cases comprise about 12.3% of cases overall. And again, this is based on reporting data, which we know can underestimate, or it underestimated before, but now probably is really underestimated because a lot of people are doing home tests or maybe not even testing at this point. And we would continue to encourage people to use their home tests specifically to help implement measures that could reduce transmission overall. So actually, this is a slide that Dr. Henderson had cited when we were sort of going back and forth in email last week, which highlights that we are still seeing pediatric hospitalizations, and specifically, we're actually seeing these hospitalizations, which I'll show you in a second with regard to UMMC data in the younger age group. So the age group that's having the highest hospitalizations, as you can see, are one of the higher rates, does include overall pediatrics, but also specifically younger children right now are the ones who are actually being hospitalized. And of course, that makes sense because these are the children who are still vulnerable to infection. And Dr. Byers already reviewed this data, so we'll go over it extensively again, but you can see actually we have had increases in hospitalizations and COVID cases in younger children. Unfortunately, we have not seen recent pediatric deaths. However, if we're not continuing to be aggressive and vaccinate our children and test and make sure we're implementing measures to reduce transmission, inevitably we will see, unfortunately, pediatric deaths, as Dr. Byers alluded to. So this is data from the medical center itself. Of course, it's reflective of what the Department of Health has reported and also nationwide data. But this was provided by Leroy Hung and Philip Hankins at the medical center, who actually track our COVID inpatient admissions. And these are the pediatric COVID inpatient admissions as of June 20th to 26th. So you can see that we actually are going into a tiny little bit of an increase again here. And I asked for an age-specific breakdown for these admissions. And what you can see here is the admissions we've had recently for COVID, while they're not as high as what we've seen in Delta or Omicron waves, we are actually seeing still children being admitted, particularly in the younger age groups. We've had a few admissions in children under the age of 6 months, and actually a few recently with those 6 months to 5 years. Just on service a couple of weeks ago, I had a few calls also from outside hospitals, and the children who I got calls about were children who either were not eligible for vaccine or were eligible but hadn't been vaccinated yet. So again, contextualizing this, the American Academy of Pediatrics, their SARS-CoV-2 reports as of June 23rd indicated there are 68,000 more child COVID-19 cases reported for their most recent report. And I just highlighted this fact. These are direct quotes from the AP report, but I'll just highlight for you in the interest of time that although reported new child cases have decreased substantially since Omicron, as you saw with those graphs that we just talked about, including those at the medical center in terms of just hospitalized pediatric cases, overall pediatric cases are higher than they were a year ago, when at the same time about 8,400 child cases were reported. And again, the overall pediatric cases, what we're seeing in terms of hospitalizations is actually, again, reflective, probably, which makes sense, is reflective of children who are not eligible for vaccine. Or who were too young to have been vaccinated. And so that's why it's so important for us to emphasize now the availability of the vaccine, and obviously why this talk is so important to explain to providers how to get these vaccines into our little children's arms so that they can be protected. Again, as a reminder, I think this is important even for myself. I have to say that, we have to remember we're still in a high transmission area. If you actually look at Hinds County and the CDC COVID-19 county check. So I'm of course talking about Hinds County because that's where I live and work. And of course, those of you in other parts of the state can do this for your other regions. And I know Dr. Byers presented county specific data a little bit earlier. But in Hinds County, community level is still high, which means that masking really is still recommended. And we should remember also those with COVID have to isolate for at least 5 days. And if they're coming back to work after 5 days, they have to mask. Remember, again, this is the Department of Health website, talks about availability of home COVID-19 test kits. This is something that, I referenced earlier and said perhaps people are not reporting positive results, but really they should, so we can actually track data. And the Department of Health actually does ask that if there are positive home test results, that they actually do get reported to the Department of Health, and there's information on the website as to how to do that. Really briefly, I'll talk a little bit about why vaccination is still important. So we actually had worked on this paper with the Overcoming COVID-19 group, or the one I'm going to talk about in a second, we've worked on, but this is actually a study, I'm sorry, from Israel that actually looked at real world data for the Pfizer vaccine and efficacy, real world data efficacy against Omicron in children 5 to 11 years of age, because data in this group, of course, has been somewhat limited in terms of real world information. And the long and the short of it is that the estimated vaccine efficacy or effectiveness against documented infection in this study of almost 100,000 children in Israel was about 17% after the first dose, and about 58% at 7 to 21 days after the second dose. So that's actually quite important to note, but also we will talk a little bit about maternal vaccination and the impact of maternal vaccination, because we're talking a bit about the efficacy of the vaccine and the importance in the Israeli study showing protection in the younger patient group. But when we talk about children less than 6 months of age, because the vaccines aren't available for that age group, we know that if we vaccinate mothers, there is actually a substantial decrease in the risk of hospitalization for SARS-CoV-2 in infants who actually are very vulnerable age group to serious SARS-CoV-2 manifestations. And if you actually vaccinate moms against SARS-CoV-2, the effectiveness of maternal vaccination in this study against hospitalization for COVID-19 is about 52%, and overall 80% during Delta and 38% during Omicron. And basically the effectiveness was 69% when maternal vaccination occurred after 20 weeks of pregnancy and 38% during the first 20 weeks of pregnancy. Again, this is probably due to transfer of maternal antibodies. So we just wanted to emphasize, what does all this data mean? It means that there is still efficacy of the vaccine. We are actually lacking data right now in terms of published studies to show what the efficacy of the vaccine is against the great grandson of Omicron, or BA4, and the variants that we're seeing now. But we know from Dr. Byers' data and from data we're looking at right now that deaths overall are down. And just talking to some of our adult ID colleagues from the medical center yesterday, we are still seeing people sick from SARS-CoV-2 and being hospitalized, but the proportion of even adults who are on oxygen alone is dramatically reduced since what it was before, largely in part due to vaccination. So I know I don't have a whole lot of time here, but I won't review in detail the vaccination schedules that Dr. Byers has already reviewed. But just suffice it to say, if you would like cheat sheets in your offices, of course, the American Academy of Pediatrics has quick reference guides for COVID vaccine dosing with color coding, and also CDC has something similar. Remember that your groups really are divided into not only by age, but whether or not children are moderately to severely immunocompromised in terms of their dosing regimens. There have been a number of questions regarding what dose to give to whom if children are between series. And the long and the short of it is that there's information on the CDC website, but really your dose should follow the age of the child at the time that they are due. But if you give a dose that's lower to a child who should have gotten a higher dose based on their age, you don't have to repeat that dose. But if you actually look at the CDC website, there's lots of information with regard to what exactly to do, and these lovely sheets that you can put up in your office. Would just like to highlight, we still have questions with regard to pediatric outpatient treatment for SARS-CoV-2. And I just like to basically highlight the IDSA website, which has very beautiful algorithms that talk about what to do if you have a patient who is SARS-CoV-2, if they're symptomatic or not. And also if they're symptomatic or not, if they are symptomatic by a timeline, what do you do? So if it's more than 8 days, even if they're symptomatic, if it's been more than 8 days, there's not a whole lot more that you can do. But if they're asymptomatic, you don't need to be obviously tremendously aggressive. But if you have a patient who is immune compromised and you're at less than 5 days, you do have options in terms of giving outpatient remdesivir, which actually is approved for children over 12 years or over 40 kilograms. And actually there is dosing also available down to 3 kilograms if you have a child who is sick and who is outpatient and not requiring hospitalization. There's an option to give outpatient remdesivir. In addition, there's of course the Lilly antibody, the bebtelovimab, which is also available for those 12 and up. And I know the Department of Health actually has some specific recommendations and links on their website with regard to getting monoclonals. Basically, of course, Paxlovid and molnupiravir are other antivirals. And I can't go over this in a lot of detail right now in the interest of time, but please, if you actually look at the IDSA COVID recommendations, they have this very beautiful algorithm that gives you, and as you can see, great detail, pediatric specific and relevant recommendations to treatment. But the long and the short of it is that if you have a patient who is immune compromised or is not hospitalized yet, there are options for treatment. And also for children who are immune compromised, there are options for post-exposure prophylaxis with Evusheld, which I'll talk about in a second. MISC, of course, still potentially is possible, but we haven't seen any cases at the medical center in several months. And if you actually look at our Department of Health website, we haven't had reported cases actually since February. CDC nationwide tracking data also reflects similar trends. But again, remember, there's the American College of Rheumatology version 3 guidelines, which are what we follow at the medical center for treating these children. And if you do have a specific case or you're concerned about a case, the cases do have to be reported. And if you're ever concerned about a case, there's information on the CDC website that you can look at in terms of flyers and brochures that you can post or hand out to parents. But also you can always call your friendly Peds ID physician, UMMC, if you have questions. And remember, again, there's also very specific post-COVID information in terms of what you're supposed to do for follow-up. I would like to emphasize that I know a lot of pediatricians are going to be at this time seeing children in preparation for school physicals. And it's actually a really important time to ask, has your child been vaccinated for COVID? Have they had COVID? Because there are specific recommendations, obviously, to vaccinate or to follow specific algorithms if a child has had mild, moderate, or severe COVID, which are available on the AAP website and which I have pasted here. I just want to make you aware of this. In the interest of time, I can't go through it in detail, but please be aware that these guidelines exist. Bebtelovimab is actually authorized monoclonal antibody, which looks like it does have activity against our current circulating SARS-CoV-2 strains. And there's information on the Mississippi State Department of Health website with regard to this specific monoclonal antibody, which can be given, especially should be considered for those who are at risk for progression to severe disease. It's actually available for those 12 and up or over 40 kilograms. Evusheld is something that is available for pre-exposure prophylaxis. Is specifically used for those who may not able to be vaccinated or generate a sufficient response to protect themselves against severe disease. The Mississippi State Department of Health has very specific information on oral antivirals, and very specifically Paxlovid is the one that we actually have as an option for those 12 and up. Remember, please, that Paxlovid has very, very significant interactions. And so you really need to be thinking about potential interactions if you're going to be using Paxlovid, other drugs that a patient may be on, specifically because half of Paxlovid is ritonavir, which is basically one of the most potent cytochrome P450 inhibitors known to man. You just have to be very careful when you're looking to potentially give a child who's at high risk for progression with SARS-CoV-2 Paxlovid. And remember, of course, there's information on the CDC website for long COVID. Remember, of course, masks still work. And please think about downloading this video. It's very helpful. American Academy of Pediatrics actually seems to also like the video. Remember Elvis, remember to vaccinate. And I'm sorry it took up so much time, but I was hoping to just point basically everybody in the direction of where they can find information. And I know there's probably questions, so I'm going to stop talking right now to allow for questions.
Thank you, Dr. Hobbs. We do have several questions. Darren Scoggins from Jackson asked, since there is an allowable range of 3 to 8 weeks from dose 1 to dose 2 of the Pfizer vaccine, is there any advantage to giving that second dose sooner rather than later?
You know, I don't know that I have enough information to really be able to say one way or the other, as long as you do it within that range. And, you know, certainly, although I don't know honestly the scientific validity about this, but I think a lot of it is going to be dependent upon the family and the patient. And you know, if you have them at 3 or 4 weeks and it's time for their vaccination and you're uncertain that they're going to come back and get it later, give it while you've got them there. But every family is different and every patient is different. I don't know if Jared or Dr. Hobbs have any additional information about waiting versus giving it earlier in that range.
No, I would agree with everything you said. I'll let Jared answer as well, but I second everything that you said, Dr. Byers, that there's no available data to suggest that waiting another week would be advantageous. And I agree with you that the sooner you complete a vaccine schedule, the better, especially if you don't lose people to follow up with everyone traveling also in the summertime, may be an issue.
The only thing I have to add, as far as the younger age group, didn't really speak on. I know there were talks several months ago about extending that dosing range. Maybe this was more for Moderna, from 4 weeks to 8 weeks due to myocarditis cases to lower that chance. But again, as for this age group, I can't really speak to that. I'm not real sure.
The CDC doesn't officially support waiting either on that basis, but that was something that was discussed hypothetically, but the official guidelines actually don't support any delay for that particular concern.
That brings me to one question that people have had. When children is it the same as with adults? They're considered fully vaccinated 2 weeks after their second dose, or I guess in the case of Pfizer, it would be their third dose, in terms of if they're in daycare or they're in school, not having to quarantine after exposures. To me, that would be one of the benefits of that shorter time frame, along with that's probably the reason we're using the Moderna product and not the Pfizer product in my clinic. But is that the case in daycares as well in terms of quarantining after exposures?
So, and those are based on CDC guidelines, but I would encourage y'all to look at that on CDC's website. And really the modification of quarantine based on exposure, I believe, is more dependent upon being up to date rather than fully vaccinated. And obviously an up to date definition will change based on the age of a child. For those children in daycare, obviously they're usually under the age of 5, and I believe that up to date for them would equal fully vaccinated with a primary series. But I believe up to date for everybody else who's booster eligible includes a booster dose. And that's where the piece comes in about some modifications to quarantine. I'd have to pull that back up, but we can certainly plop that resource into the chat.
Great. And I would add that for those of you who don't know, CDC does have a great calculator, the CDC calculator, where you can put in the exposure time, your vaccination status, age, et cetera, and it tells you exactly. And it's something, a tool that our nurses have used when they get phone calls from parents about how long they need to quarantine or isolate. So to me, that's a helpful tool. Another question, Dr. Randy Henderson said, I know of a local clinic giving ivermectin and claiming that Paxlovid is dangerous. Is there any way to discourage this practice?
Yeah, just with good information. Us being the ones that are the ones who are not spreading misinformation, that the information that we provide is based on the best available data and evidence, and is based on science. And you know, we hear these anecdotal reports of physicians out there who are still using ivermectin, or in some cases, other treatments or therapeutics that are not necessarily appropriate, such as, giving everybody a Z-Pack when they come in with COVID, when there's no indication of secondary bacterial infection. And we do want to continue to hold people accountable and make sure that they're not spreading that misinformation. But again, physicians are going to have the ability to prescribe in their offices.
Another question from Dr. John Godet. Will the new bivalent vaccines that they're talking about with adults, will those also be available for children this fall?
I haven't heard. I think it's a little bit early for us to say. It will be very exciting if we get a multi-antigenic vaccine for COVID, even for adults. And I think that this is going to be another step in the right direction for us to be able to roll out COVID vaccines in a more standard process. And I think having a vaccine that's even bivalent will be a big win. Will be a big win for us rolling in the fall. And I certainly would love to see them have that across all age groups.
Great. I see Dr. Hobbs has put in the chat box the information on the from the CDC in terms of the time period between doses.
So it's a consideration. So like I said, I'm sorry to follow up with this, but it's a consideration. But CDC also makes that caveat and says, well, it's you're potentially delaying how much protection you get, but it is a consideration for those with myocarditis. The other thing is that MISC, as a reminder, one has to wait 3 months if there's an event of MISC for immunization. And CDC also is now recommending that for those who have been vaccinated, if they contract COVID, that they actually theoretically could wait 3 months before getting vaccinated. But then they also put that additional caveat in that's similar to this one, that if you delay vaccination, you also increase your risk of maybe not being as protected. But in theory, about 3 months after once infected, there is definitely more protection. So there's not a mad rush to get vaccinated if you've had COVID in between doses. But I actually wanted to just qualify what I said earlier, because it is hypothetically a consideration, like I said, with regard to myocarditis. And so if you do have this longer period of time, you wait 8 weeks, it's obviously possible to do, but again, you increase your risk for infection, as they say on the CDC website. I hope that was clear as mud, right?
I think it was. I do think one thing that would be helpful, and I really appreciate Dr. Buffington and Byers and Hobbs coming on and doing this for us, because all of this information is confusing. We have multiple options now and different sort of schedules, so our parents have questions. So having this information is helpful. Again, we will have the recording available that we will send out later on. But if the three of you would also possibly send us the slides, Deanna could kind of compile that together and send it out as well, just so that our pediatricians around the state have those slides to refer to or print off to help their nurses and help their staff as we schedule and as we try to vaccinate our children. Any additional questions out there? Dr. Byers has put the quarantine and isolation guidelines from the CDC along with up-to-date on COVID vaccines from the CDC in the chat box as well. So I think both of those are really helpful.
No, and I think it may be worthwhile for us as we roll this out to Dr. Henderson, and that there may be more questions down the line as the pediatricians who may not have jumped in as quickly as some of the others to go ahead and start administering these doses to children may have some additional questions in the coming weeks as we continue to roll out the ordering and distribution and administration of these doses. And we also have to be pretty flexible, because we know that guidelines from CDC and FDA can change pretty quickly. So if there is a need, we can certainly be available in the coming weeks for another presentation.
Great. Well, thank you guys so much. And we will get this out to everyone. Please share with your partners. If you have any specifics or questions, reach out to me. Or you've all got Deanna's email, and Dr. Byers and Hobbs and Buffington will all help get you the information that you need. So thank you guys so much. You'll have a good afternoon and have a good 4th of July weekend.
Thank you, and we'll send
Bye.
out those slides.
Yep, we'll send the slides. Thanks, guys.